When conventional medicine doesn't quite hit the mark for chronic health conditions, what's the next step? Today's guest, Dr. Rebecca Kennedy from Portland, Oregon, has explored this question in depth in her 20-year career in family medicine. For those that are new here, hi, I'm Raelan. On this channel, we discuss recovery strategies for conditions like CFS and Long Covid, offering a platform to learn from diverse experiences and approaches. In this episode, Dr. Kennedy will share her extensive experience in treating Long Covid patients and other conditions with a unique neuroplasticity approach rarely found in the conventional medical system. She'll share the scientific evidence behind the brain-body connection in Long Covid and discuss what she has learned from observing patients' responses to this paradigm-shifting treatment. Let's welcome Dr. Kennedy. Dr. Kennedy, I am so excited to have you here today. Thank you so much for doing this.
Yeah, my pleasure. I'm looking forward to it as well.
So, as I'm sure you've noticed, I guarantee people who are watching have noticed that your approach to treatment, although a direction that treatment is going and very much evidence-based, is not what most people find when they go into their doctor's office. So how did you get to this place, or how did your treatment approach evolve to be what it is now?
I have been a family medicine physician for 25 years, and over the years of working with patients, as a family medicine physician or a primary care doctor, we see all of what's going on with a person and all of their organ systems and their mental health and what has gone on for them in their life over the years. And I just, over the years, saw pattern after pattern after pattern of patients that we could not help. And it's really a lot. And the medicines don't help necessarily. Going to mental health doesn't help, or, different specialists. And they still end up with primary care. And so we see them over the years. And it just became this intense curiosity that I wanted to solve and figure out why our medical system could not help so many patients more than we can. And often the patients that sort of were in this category had a lot of similar sort of symptoms in their body: pain, migraines, or GI discomfort, or IBS, insomnia, anxiety, depression, kind of all these different constellation of symptoms around the body, but yet we couldn't help them that well. So I literally just searched and searched and searched for other science and other approaches. And I was constantly reading or taking a CME class. I went to the Harvard Mind Body Institute, or the Benson Henry Institute, and would get pieces of information that were helpful, but nothing that quite got there. And then fortunately, a friend of mine from medical school, I went to University of Michigan, told me about Howard Schubiner, and that she would send her patients to Howard Schubiner with chronic pain and they would get better. They would come back to her in a few months and tell her that he had fixed them. And I was fascinated, and I probably would not have believed it, because just like you're saying, this is so different than our traditional medical system. But it was my best friend from medical school, and it was her own patients. So I searched him out and I learned everything I could from him. And I've just really tried to learn about this whole world as much of it as I can. And I was working at Kaiser Permanente at the time, and they have an integrative clinic. And so I started seeing patients using this model and saw such incredible benefit and such incredible changes, and was seeing more and more patients doing that. And did that for a few years, and then really wanted to just focus on this exclusively because I saw the incredible power of it. So I decided to leave Kaiser and just do this on my own with my own clinic.
I am just beaming from the inside out. This is so exciting to hear. I'm sure people watching are feeling the same, because I think it sounds really familiar for what a lot of us as patients go through when we face these conditions that you were seeing where people aren't getting better. So we go down these sort of paths of trying to figure out what's going on and stumble across some of the same things. But to hear, a medical professional like yourself also exploring this with more resources, more energy, probably more connections, and to be finding some of the same things that we've been finding of helping people to recover, and just really embracing that. It's just the thought of a person going into a doctor's office and encountering you and getting all of this information and the latest, science and research to back it is just, it's just, the world is changing. It's an incredible thing.
Oh, that's nice. And I will say, I was taught like all other medical students and in my training, and there was a point in my career where I just thought, I mean, and also might seem kind of strange, although I'm sure people identify with this, where I thought, wait, this is our job. This is our job as the doctor. We don't know how to help someone. What we're doing is not working. It's not the patient's job to figure this out. It's the doctor's job. This is our role. If someone has cancer, it's not the patient's job to figure out how to get themselves better. And I think sometimes that's not the messaging, and really owning that what we're doing is not working. And so that's really what motivated me and just gave me this really intense curiosity to just look and see what else was out there.
You said that I could just feel this heavy load that I don't even knew that I'd been carrying, but just that responsibility, the terrifying responsibility of being a patient tasked with healing yourself is
right.
So terrifying and overwhelming.
It is.
And the doctors don't know the answer. I've never been to medical school. How on earth
Yeah.
am I supposed to figure this out by myself? And I can barely get out of it. So
right.
What you just said really means a lot. So once you went down this route, how did this impact your treatment approach with patients, and what sort of results did you start seeing?
It started with explaining to patients the science of what's going on and what's going on with their body and why they're having the symptoms, and starting there. And it took me a little bit to figure out the communication of how to get there. But and it was a little scary, I have to admit, when I first started saying these things or, communicating in this way, because it was so much different. But what kept me going is so many patients saying to me, wow, that actually makes a lot of sense. That's the first thing that a doctor has said to me that actually makes sense. And the way that I describe it in general is, instead of, looking in the body, that there's a symptom in the body, that means some sort of damage in the body, instead kind of flipping that over and starting at the brain and looking from the perspective of the brain down to the body. And 95% of our brain is the unconscious part of the brain that controls the body. And so if we stand at the brain and then look from that perspective and put in kind of all these other pieces, kind of like the missing pieces of information, it really, from my perspective, all kind of falls into place and makes so much sense. And when I first started doing this, there's a part of me that was thinking, oh my gosh, am I in an alternate reality? Like, this is so much different. But now I just think, well, of course this is what's going on. This is actually the only thing that makes sense is how our brain and our nervous system connects with our body through chemical messengers and physical signals.
Yeah, it really seems a bit ridiculous to me that all of this time we've been completely ignoring our brain and our nervous system, like they have nothing to do with it. There's just this wall, the powerhouse, control center of our whole body, connected to everything, but we don't know.
Right.
That has nothing to do with it. That's silly. So you eventually started treating patients with long COVID as well.
Yeah.
Tell us a bit about that.
Well, I did start, when I started doing this work, it was during the pandemic, so long COVID was around, but I didn't start with long COVID patients as much, but really treated everything else. I mean, again, as a primary care physician, treated pain and IBS and itching. Had some patients, all they had was itching and insomnia, anxiety, lots and lots of different things. But even early on, even before I even knew about this model, it really made sense to me that long COVID still was part of kind of all of these other things that I had been trying to figure out more information about for years. So I slowly started connecting with people with long COVID and treating them with this approach. And at Kaiser, there was actually a long COVID specialty clinic that I was a part of. And it mainly was just kind of there's a few physicians that did chart reviews of the patients and would give suggestions to the primary care physicians of how to help. But essentially was kind of the main things that are suggested throughout the country. So I started seeing the patients that were really the most severe, and the people, the other physicians in this group would sort of send the ones that weren't getting better with the other approaches or had the most symptoms, had the symptoms for the longest, to see me. And I started working, again, with really the most severe patients. And for many of them, again, the ideas really made sense. And so little by little, and in working together, saw people getting better at, as you all know, very different paces. And then shortly, I just got so inundated with so many patients. I mean, it just made me feel sad that I didn't have more time to spend with them, and they couldn't get back in to see me very frequently because I was just inundated with hundreds and hundreds of patients. So I developed a virtual class, to at least come together and also just teach about kind of the core information so that then when we worked together one-on-one, it was much more efficient. And also found that the class was nice just in that sort of support, validation piece. But the beauty of it is that it's not only the support and validation, but it's also the pathway to get better and the positive focus, which sometimes isn't always out there.
Working so hard to contain my excitement. Like, really, if you could see in my head what I'm doing, I'm like dancing around the room. This is so exciting to me, the thought, because we have millions and millions of people around the world that are suffering so much and just have no information about what to do. And the thought of these people coming in to see someone like you, and not only being, like you said, supported and validated, which alone most people aren't getting, but in addition to that, also getting recovery information that helps them to get better. It's just, this is so incredible.
Oh, yeah, I know. It really, like, I have to say, it keeps me up at night how many people are suffering, and that there is, a pathway. The pathway can be a little different for everybody. It's not necessarily to say that it's the same pathway for everyone, but at least there is other information and hope.
Yeah, and even people like yourself taking the time to come and speak on YouTube channels like mine, I think it says a lot, takes humility, takes just a lot of great things, something from your heart wanting to put this information out there. And because most people, this information is out there, and I've, gone the hole of reading and finding everything I can on the topic, but hearing this information from some random YouTuber or Instagram account versus the medical community is a whole other thing, because it can be really hard to know what is real and what isn't, and what is evidence-based and what isn't. So I think I'm hearing you say it, but I think it's just really important to make this message clear. So these approaches that you're talking about, they're not woo. These are in science.
Right, exactly. If we kind of just, what I do with my patients is really just step back and look at the whole picture. And so with long COVID, for instance, looking at the whole picture of it is that, I mean, as a family medicine physician, and as and I became the lead of the long COVID clinic at Kaiser eventually, is that sometimes patients have had COVID infection when they develop long COVID, but sometimes they haven't. Sometimes they actually just had the vaccine. And then I've even seen patients who had some symptoms prior to even the pandemic starting, that then those same sort of symptoms worsened afterwards, but still have the same pattern and constellation of long COVID that people have around the world. And $1 billion has been spent by the federal government and getting us no closer to an answer by looking in the body. And so if we really step back and we look at all of those different pieces, again, the only thing that makes sense is that it's the nervous system, and the nervous system being hypervigilant and stuck in the on mode, and then showering down all these signals in the body that are then stuck in place. And not only looking at the pattern of the pathway to get to the symptoms, what the symptoms are, but then the most beautiful part of it, that people get better. When we attend to the nervous system and think about it in this way and put in the tools, people get better. And that's the other piece. And it's, I see it over and over and over again, just in my own patients. But then, like you're saying, that evidence-based medicine is that this model in the first place, sort of based in chronic pain, has had the NIH study with the Boulder back pain study of 150 patients with greater than 10 years of pain that had significant improvement. 2/3 of the patients got to 0 to 1 out of 10 pain after a few months. And then the same sort of approach done just in the pilot study at Harvard on long COVID patients, but the same sort of results of 2/3 of the patients had significant improvement with using this approach. That same approach was also done at Harvard on chronic back pain patients as well. So some studies, certainly lots and lots and lots of specific stories of people getting better, but also really around the world, different physicians and clinicians using this approach and also seeing the same sort of thing about the improvement. And the other part is that it's safe. I mean, it's not doing, potentially dangerous procedure or medicine or, anything that could cause harm in that way. And I think that's part of what concerns me, frankly. And also what keeps me up at night is I just see so many people going down the path because they are desperate and don't have other answers of doing potentially dangerous things, of with some procedures or medicines that could potentially cause harm.
Taking 50 different supplements at once just because you hear about all these different things that people are doing.
Right. And of course you're going to do that. Of course you're going to do whatever you can to try and get better, for sure.
So in working with long COVID patients and using this approach for the people who are seeing progress and are recovering, can you give us a general sense of what that treatment approach looks like? Like, what do we do with this now that we know that we're so strongly suspect there's a autonomic nervous system, a neurological component? What now?
Yeah. So most of it is not intuitive. And it takes a bit to wrap your brain around, because what we're used to is what we call an acute injury, which means, something that you've damaged your body acutely or, right in the short term. And so like a sprained ankle or a broken bone or other sort of damage in your body, like an infection or a tumor or some, actually profound damage to an actual nerve. And that all follows a specific pattern. And that's actually what our brain evolved to respond to. And that's why we're alive on this planet, is because we evolved to respond to those sort of acute injuries or damage in our body. And it's really important. And one of the sort of missing pieces of information that I didn't know, and most physicians don't know, and I just learned a couple of years ago when I learned about this work, is that pain, for instance, is a signal that is created by the unconscious brain in order to protect us. And all pain is made in the brain. And if we damage our body, if we break our hand, the nerves out in our hand do not generate pain. They send the information to the unconscious brain, and then the unconscious brain interprets that information. And when it interprets the information as danger, it then sends the warning signal back down to the hand in order to let our conscious brain know that something needs our attention. Do not move it so it will heal and we don't die. And that makes perfect sense, and it's really helpful. And when we have an acute injury, that's great. That's what happens. But with the nervous system and the chronic symptoms, our brain has a bias towards danger. All it cares about is staying alive on this planet. And it's just the primitive brain that's just automatic and reflexive. And so when the brain is interpreting that there's danger in the body or there's danger, it's sending these warning signals, but the warning signals don't mean that there's damage in the body. And so in order to turn off that warning signal, it's not about not moving the body. So if our hand is broken, we want to not move it. But with the chronic symptoms, where it's the nervous system signaling, and it's the hypervigilant nervous system that's creating the signal, we actually need to do the opposite. We need to show the unconscious brain that our body is not actually damaged. And part of the way that we do that is actually by moving it. But we don't want to move it way too much, or the brain is just going to reflexively respond to that by creating more symptoms. So part of it is showing our brain. And again, we can't get there by thinking. We can't just use our conscious brain and think it changing, because our conscious brain is not connected. It's like trying to say to our brain, stop your nails from growing. That's how much control you have over it. It's just not connected. So we have to do it in different ways. And we have to show our unconscious brain different information. So part of it is by doing activities or moving, but doing that through a sense of ease and joy and safety, which again is not intuitive, because you don't feel like that when you feel terrible. And so it's kind of it's a challenge to do that, but it's putting those pieces in little by little. It's sort of like putting the cart before the horse. When you have an acute injury and you sprain your ankle, you wait for the pain to go away before you start walking on it again. And this is the opposite. You start walking on it while the pain is there, while the symptoms are there, in order to get it to go away. Or with the fatigue, that you use your body, you move your body in order to get the fatigue to go away, rather than resting and staying in bed. But again, you don't just bust out of your house and go run a marathon. It's just little by little, and it changes every day, and the road goes up and down, and it's hard and frustrating. But so that's part of it.
That was explained so incredibly well. And every person I talk to, like yourself, I start to understand my own journey a little bit more. It was interesting because I recovered from 10 years of chronic fatigue syndrome, and I had never heard really of the autonomic nervous system or brain training or, threat assessment system, limbic system. I didn't understand any of it, but I recovered anyways. And it's only through these conversations, I credited a big piece of my recovery to exercise, but I started with 1 minute a day, maybe every second day, just like moving my arms. And I thought I was reconditioning my body and strengthening it, but I realize now, and then every week, if I felt up to it, I'd add on another minute. And I felt really at peace with it. I'm like, I know it might make me feel a little bit worse, but this is safe. It's okay. And I felt like in control of my recovery. So I had all this positive association with it, and like, I'm doing something, and it worked. But then I tried running again after I was doing, hour-long workouts at the gym, pushing as hard as I could on strength training. But then I started running, and all that exertional malaise came back. So I had to go back and do the same thing. So I see it now as like this sort of brain training program of gradual re-exposure therapy, of just making it a happy, fun thing, and that it's safe. But yeah, had I tried to just go to the gym for half an hour, I probably wouldn't have got out of bed for months.
Yeah, right. And we're so used to responding to those symptoms in our body that we need to protect ourselves. And that's what the unconscious brain is sending. It's saying, oh, stop, protect yourself. You're damaged. And that's how our brain evolved. And that's how we spent our whole life understanding. So it makes perfect sense that that's how we would respond. And again, it's just not intuitive, which is, again, I think why, a lot of people don't know about this. And it takes a bit to get there. And our brain keeps trying to stop us.
Yeah, I've heard it explained. It's like we've become experts at being sick because we have months or years or decades of, exercise bad, exercise danger. It's going to make me feel worse. Leaving my house, danger. So it's so in there. Like our nervous system is instantly protecting us. Like it is trained well. It is, you are not going to the gym. You are not going for a walk. So
yeah, and what that is, that's a neural pathway. That is from the unconscious brain to the body. It's just a learned neural pathway. And then the more that it's activated, the better our unconscious brain gets at making it. It's just like learning to type. And you practice and practice and practice, and you do it without consciously thinking. It's just automatic. So then you take the keyboard away and put a new one down, and the P is on the left instead of on the right. You are not going to be able to type instantly. It takes time. And then maybe you're doing better with the practice, and then you don't type for a little bit, and then you type again, and then your right finger goes right to the right again. Again, it's really those neural pathways that are just reflexive and automatic, stuck in place. Our brain has a bias towards danger, and so it wants to just keep going back there because it's the primitive brain believes that this is good for us. This is what is protecting and helping us.
And I think something that is hard for people to wrap their head around and a little bit scary, but then also ultimately empowering is that, a message that I'm hearing from a lot of people that come on this channel is that ultimately they came to realize that despite the extremely debilitating symptoms they had, possibly bedbound, just really in a world of hell, they came to realize and appreciate that their body was actually fine, which can be a strange thing. But like you're saying, that pain doesn't live in the arm, that extreme back doesn't live in the back. The back isn't causing it. Because many people I talk to who I interview at some point in their journey were quite certain they were dying. There's no way I have this level of symptoms. They started affairs in order. It's terrifying. So yeah, it's such a mind shift to understand things from this different way. Take a little bit to get there, but it's really in the end.
Yeah. And that is such a key point. And that, moving your body is just, one piece of it. But really, you have to start at the beginning, and you have to start at understanding the science, and then really understanding how the science applies to you, and that it is the nervous system, not damage in the body. And that is not easy. And also really understanding that the brain it's this shower of chemical signals. So it's not that you don't see changes in the body sometimes, and you can see redness and swelling and the GI system not functioning and maybe muscle spasms, or you literally can't move your muscle, your arm, or, whatever it is. Like, these are chemical signals. And there's a lot of studies actually that shows there's specific cytokine changes and mitochondrial changes when our nervous system is stuck in the fight or flight mode. So there are real structural chemical changes happening in the body. It's just that the root of it is from the signaling in the brain, the neural pathways, rather than the damage in the body. And that is not easy to wrap your brain around at all. But the more that, as you progress through this, and really starting from that standpoint is the part of the pathway to get better. And the example that the analogy that I find helpful, that I use with my patients a lot, is that, so our brains are 95% of our unconscious brain is like the 3-year-old, and the conscious rational brain is like the parent and the adult rational brain. And we need to convince the 3-year-old that there isn't actually a monster in the closet. And if they think that there's a monster in the closet and the fear is turned up, they're not going to sleep. And if the parent goes in and soothes them and says, "You're safe, you're okay," the fear will get dialed down and they'll go back to sleep. But if you don't teach them that monsters aren't really real, the fear is just going to go right back up when the parent leaves. So a lot of the tools that many of us know about to dial down the nervous system is really just the part of the parent going in. Meditation, breathing, even exercise, social connections, sleep, kind of all those kind of quote unquote stress management tools. They're helpful. That's important. That's good. But it's not enough by itself. And I see a lot of frustration with people, and they say, "Well, I'm doing all these things and I'm not getting better." Well, it's not enough. We need to walk towards the closet, open it, go in there, and teach the brain that it doesn't actually need to be afraid. And when we do that, that's what dials down the fear and keeps it down. And that's what the other pieces are. So things like the pain reprocessing therapy, I call neural reprocessing therapy because I use it for lots of different symptoms. And that's sort of moving your body through the lens of safety. Also understanding why our brain what our brain learned throughout our life, of how it's responding in terms of fear and threat, kind of what our thoughts are, what the experiences are, how our automatic responses are included. And then also how our emotions are involved. And that's just an innate evolutionary part of it. And figuring out how that piece is involved as well.
You have pretty much succinctly summed up everything I've read and heard from other doctors and experts on the channel. It's so incredible because it's the same message. And I think the more people hear it, because it can be kind of a tough pill to swallow, so to speak, because it is such a dramatic change in the way we think about things. And you said even most doctors 2 years ago, or even now, don't have this understanding. So it's understandable that they're like, what? And they feel a bit invalidating, like, because of course.
Oh my gosh, very invalidating, incredibly invalidating.
What do you mean my body is fine? I haven't been out of bed in 3 years.
No, exactly. And really, it's, this is the new science. And like any new dramatic change in science, it is not easy to understand initially. And people resist it, understandably, because it's so different than what we thought. And it's very understandable that the message initially, might be that difficult to take. And I get that. And it's funny, not very often do people kind of take offense to this, but when they do, I just really try to sit with them in compassion and understanding. And I've had people yell at me for an hour on the phone, and I just sat with them that and I get it. I understand. I know it's hard what the messages that they've had and gone through, and sometimes this can sound similar, but really looking into it and really delving into it, it is critically different.
So I have a feeling that every single person watching now wants you to be their doctor. So I know I do. I'm calculating the drive time in my head, and I'm not even sick anymore. Like, I just need more of you in my life. So what sort of support do you have for people, whether remotely or people in the area? What's available for people who are wanting to connect with you?
Oh, that's nice. Well, so my clinic is Resilience Healthcare, and I connect up with people actually around the world virtually. I kind of work as a coach outside of where I'm licensed, which is Oregon and Washington, and I'm in Portland, so I see people in person if they'd like here, but otherwise I just meet up virtually. But I continued with my virtual class so that I could try and reach more people and have an affordable option to get the information. And the virtual class at this point that I have is 8 weeks. And I do one actually that's just for long COVID, as well as a separate one that's kind of just for any sort of general neural pathway symptoms. And it's the same information, but because there's just so much information out there right now about long COVID, and it's just so confusing, I find it helpful to just really explore all of that together. But there's also, there's lots of ways to find this information as well. There's lots of great coaches. There's, Dr. Schubiner has his free program on Coursera, The Reign of Pain. There's books, lots of different places. And really my motivation is to just get the information out there, however people can connect and just know about this, because it's just knowing that this is even there, that there is hope, there is a pathway out, and there's lots of different ways to connect up with getting that information.
And you had mentioned before we started, when we were off air, it's not just you. To me, it feels like you're the one person in the world who's doing this, but it is happening all over the world. Like, this information is, this is the new way forward. It's not.
Yeah, right. Again, when I first learned about this, I knew about Dr. Schubiner, and I thought it was just kind of him, and maybe a couple other people, or Dave Clark is started the PPDA in Portland, who's a GI physician was at Kaiser as well, doing amazing work with GI symptoms for years and years. And I sort of thought it was just maybe those couple people, maybe a couple more. But as I've spent so much more time in this world, really realizing that it's physicians, clinicians, all scientists, all over the world, in Europe and Australia and America. And it can seem, just like you're saying, finding the information. Maybe it's a YouTube video, or maybe it's this one person over here. And it's hard to really understand the breadth of how many people are doing this. And many of the people doing it have actually been doing it for decades, for 20, 30 years. It's just that it has not made it to the mainstream medical community because it's so different than our medical model, which is, if there's a symptom in the body, we do a test to identify the structural reason for that symptom, and then we treat it with a pill or a procedure. And that's our medical model. And that is fantastic when there's structural damage in the body. But 50, 60% of the people coming into primary care do not have that reason. It's the nervous system. And if we're trying to go down that same route and treat the nervous system problem with a pill or a procedure, we're just not going to get there.
Yeah, and it helps explain why so many of us go through a ridiculous amount of comprehensive testing and everything comes back fine.
Yeah, right, exactly, right. And so what I say to that now, and how I coach other physicians, is to say, your testing was normal. I can understand that it can be frustrating because you have these symptoms that are, debilitating, horrifying, overwhelming, taking you out of your life. And it can be frustrating to have normal testing that doesn't show the reason for your symptoms. But it's good news. We now have new science that we now understand it. And we not only understand it, but we actually have a pathway for you to get better.
Dr. Kennedy, I could reach through the camera and just hug you. I'm so grateful for you. Thank you so much for doing this today. For those of you watching, of course, please expand the video description, and all the links and everything you need to know to connect with Dr. Becca Kennedy is there. She is clearly what we need more of in this world. And yeah, I really appreciate everything that you're doing. And I hope you never stop, because we need this so badly. So thank you.
Thank you. I appreciate it. It's great to connect up.
And those of you watching, what do you think? Oh, I'm so curious to hear your thoughts on this video. I'm just really jumping out of my skin right now with excitement. This is, for years, I've been giving people the message, sort of like, don't ignore medical advice, go to doctors, do all the tests, but sort of saying, that being said, I invite you to strongly consider that you're not going to find, if you don't initially find your answers through the conventional medical system, you're probably not going to find them, and you might have to search elsewhere. But now more and more people are finding what they need through people like you, which is incredible. So yeah, thank you. Thank you so much for doing this today.
Oh, you're welcome. Thank you for having me, and thank you for what you do as well.
Oh, it's an absolute honor to do it. All right. Thanks to those of you watching. I know this can be a lot to take in. I send out a newsletter every week that kind of highlights the main takeaways. If you haven't already signed up, there's a link in the video description for that as well. There's a ton of great information out there. Never more reason to be hopeful in all of time than right now. Whatever you're facing, that you will find your answers. So hang in there. I hope you enjoyed this video. I hope you got a ton out of it, and I hope to see you in the next one.